All right. Good afternoon, everyone. Let's start. Let's start this workshop. So welcome to our workshop organized by the BRINC project, Procuring Recycling of Single-Use Sanitary Materials. So my name is Anita Lombardo. I am working at ACR+, the Associations of Cities and Regions for Sustainable Resource Management. And ACR Plus is part of the BRINC project, which stands for Brokering Cross-Border Innovation Through Clusters. And today's workshop is in the context of this project. In case you haven't heard or don't know much about it, we will surely hear a bit more about the project by one of our guest speakers, Joan Jula, also coordinator of this European funded project. So let me just quickly show you our agenda for today. As I said, we will have a quick introduction of the BRINC project to help you contextualize a bit better this workshop and let you know other initiatives that we have done and we will do in the future. Then we will have a short speech by our Secretary General, Françoise Bonnet, introducing the challenges and opportunities of managing sanitary waste. And following that, we will have a presentation by Jordi Pojadas from the Catalan Institute, Health Institute, about their procurement journey so far to reuse and recycle their sanitary waste. So this is what's coming on today. And before we start, we wanted also to launch a quick poll just to know a bit also about you. So who is sitting around this virtual roundtable? And this will also help us understand a bit more where the inputs are coming from later on, because I forgot to mention the maybe most important part of our workshop following Jordi's presentation will be an exchange of inputs through a Miro board. So you be able to contribute, give your comments and suggestions. So just help us understand a bit who you are, as it's too many of you, fortunately, or I would say, to do a proper roundtable orally. So just if you feel like it, just fill in the poll to let us know a bit which type of organization you're presenting today at this workshop. And then Gael, you can maybe have a better visibility than I do on when they start filling the poll, which we can keep open, I would say, in the meanwhile. And I suggest we maybe move on. Maybe let's just leave another minute. So we try to add what the main groups. We hope that you feel well represented in these different categories.
Yes, I think we have all the participants responding more or less, with the majority for public hospital or healthcare center and for municipality or public body.
Great, super interesting. Looking forward to hear or read more from you later on. So thank you for participating. You can keep filling it in. It would just be more interesting for us to know, again, a bit more about you. But now let me give the floor to Joan to just quickly present you the BRINC project. So the floor is yours, Joan, and thanks for joining us today.
And would you like me to share some slides or no, or do you? I will quickly, can you see this now? Very nice. Good. Okay. But as Anita said, I will try and be quite quick, and then I hope that if you want to know more about the project or anything, you can contact me or Anita or any of us from the project group. But so as Anita just said, that BRINC stands for Broker and Cross-Border Innovation through Clusters. And really the point is to accelerate the uptake of innovation within circular economy and build on this thought that public procurers can play a big role in getting innovation to market. And especially if we pool this demand also across borders, can be very effectful in getting new innovation to the market. So that is what we are trying to do. A little bit here in graphic what we want to do. So we want to connect the public buyers with the innovative ecosystem, and that is also part of this process that we are in today. We can see a little bit how we do this. We will try to do 2 to 5 procurement buyer groups through this whole process of buying in innovation. And this is one case that we're currently working with. So the purpose of today's workshop is to explore this need of single-use or less single-use PPE and see if we have some joint needs across, and then how we can take this further. Hopefully we will then go on to help with engaging the market and see what exciting solutions are out there. So that is kind of the context, and in the project we will do this process with more cases, and we will also develop some training material for these 3 groups, the innovative SMEs, the public buyers, and then kind of us, we call it InnoBrokers, the kind of in-between organization that can help bridge this. So that's the very kind of a quick intro. I just wanted to mention also that we have this online platform, and I think that Anita can share the slides afterwards where you can join and then follow and have updates on everything. Thank you.
Thank you, Joanne. Thanks a lot. And thanks, guys, for also sharing the link to have further information on the BRINC project as a whole. So without further ado, I would now give the floor to my ACR Plus colleague, as you can see from the same background, Françoise, who is joining today, and the floor is yours.
Thank you very much, Anita, and hello to everybody. On behalf of ACR Plus, I'm really pleased to join this workshop because it's important for us as a network of public authorities. And I will give you a little bit of context on the topic. I will start maybe with a number that might be surprising and go against the idea you have of healthcare, sanitary waste. Did you know that according to the WHO, out of the total amount of waste generated by healthcare activities, about 85% is general, non-hazardous waste comparable to domestic waste. And the remaining 15% is considered as hazardous material that may be infectious, chemical, or radioactive, so with a proper treatment for them. If turning this into measurable quantities, high-income countries generate on an average up to ½ kilo of hazardous waste per hospital bed per day, while low-income countries generate an average of 200 grams. However, healthcare waste is often non-separated, and this means that they are all considered as hazardous waste, mainly in developing countries, low-income countries. And of course, it makes a huge quantity of hazardous waste. The question and also focus of this workshop is how to manage this waste. The first step for sure is to segregate what is hazardous from what is not. But another important concern is what to do with those healthcare waste. Most of them, most of the time, they are landfilled or incinerated. And of course, keeping in mind the health impact, we have also to consider the environmental impact of sanitary waste management and dedicate more attention to other and new solutions. In general, we know that when fighting against single-use items, the first consideration to have is to ensure that there is no alternative to avoid the use of single-use items. In our case, when tackling this issue of single-use sanitary items, an alternative does not often exist due to the health impact, but can exist. I'm curious to hear from you. The result is, of course, an important quantity of waste produced constantly every day. But other solutions than incineration and landfilling exist. So today is how to incentivize this innovation solution. As public authority decision maker, we have in our hands an important tool that allows us to promote this solution. I mean, public procurement. Let's so investigate and promote more sustainable solution, reuse or recycling in public hospital and healthcare centers. This is this topic for the today workshop, and I wish you fruitful discussions.
Thank you, Françoise. Indeed, thanks for highlighting how important this topic is. And indeed, today will be about challenges, but also about solutions. So I'm really looking forward to hear more about Jordi and their procurement journey, and also about all the participants. So before we move on to Jordi's presentation, we still wish to launch another poll to know from you what you think in a word or two, maybe one of the biggest or the most, let's say, difficult challenges related to sustainable management of sanitary waste. As I'm sure you will all have been faced with some of them at some point in your healthcare centers, hospitals. So let us know a bit in a couple words the barriers that you think we're facing here. Okay, I'm able to see some of the words popping out. Super interesting. So the volumes, yeah, and hygiene regulations, yeah, that's also what Françoise was highlighting, this tension between health and environmental impact, transport costs, and different fractures, which I guess maybe it's fractions, a little bit of hospital language, biohazard, lack of a system. Plants, it's gaining weight in this whole word cloud. Laws, okay, I'm happy that it resonates with some of the things we have chosen for the Miro board later for the discussion. Costs. Okay, thank you all for filling it in. It's becoming bigger and bigger, so it means we will have indeed a fruitful discussion soon enough. So for now, I see that costs are still the biggest one. So taking into account all these different challenges that you're referring to, I wish to move on to Jordi's presentation and to see a bit whether the Catalan Health Institute has encountered some or all of these challenges. So let's see a bit what was their journey and how that resonates with the challenges you're mentioning. So again, welcome Jordi to our workshop, and I'll give you the floor, and you can keep filling in the poll, by the way, as Jordi presents. Feel free to do so. But yeah, Jordi, the floor is yours.
Okay, thank you, Anita. Thank you, and thank to the ACR Plus and the BRINC projects for inviting us. I'll share my presentation. So, okay, can you see it?
Yes.
Okay. Well, I'm Jordi Pujadas. I'm environmental technician at the ICS. First of all, I'm going to start by telling you what is the ICS. Sorry, the presentation doesn't go forward. Okay.
Yeah, we can see it now.
Okay, sorry about that. Okay, the ICS is the biggest public healthcare provider in Catalonia. Some numbers to make you can make an idea of who we are. We have 6 million people as referred population, which is about 82% of Catalan population. We do this attention in 8 hospitals, 332 primary care centers, and more than 600 rural medical offices. So as you can see, it's about 1,000 places where we give our service. And all of that, we do it with the most important part, that's our professionals. We are more than 52,000 right now. So as you can see, it's quite a big organization. What we do is keep people healthy, from primary care to specialized care and hospital care. We do prevention, we do health care to keep people healthy. That's our aim. But healthcare is a human activity. As any other human activity, we have an impact on environment. We know that, we have to know that, and we have to act accordingly. So to make this impact as low as possible, because we're in a world that's more and more hurt. So we have to try to make this impact as low as possible. From all the impacts on the environment that we may have, one of the biggest is the healthcare waste. Our waste it's a big amount of them. Healthcare waste is what we don't need anymore once we've had made the taking care of people. And this healthcare waste is a lot of different things. We have big amounts of them and big amounts of types of waste. So it's a challenge to manage all of them. For fit a little bit more what we're talking about, I wanted to give some legal frame in Catalonia. In Catalonia, the healthcare waste management is regulated by a decree, which is 27/1999. As you can see on the name and the codification, it's a decree from 1999, so it's almost 25-year old. It's quite old. It needs refreshing, but we know the authorities are working on a refresh of that decree, but by now is what we have and what regulates us. So it's what I'm going to explain to you. This decree says that any waste produced in a healthcare center is healthcare waste. So whatever we produce as a waste in a center, one of our centers, is healthcare waste. But this gives a lot of different types. So the same decree classifies in 4 groups of healthcare waste. We have group 1, that's recyclable domestic waste, paper, cardboard, plastic, cans, whatever we can have at home, either than in a healthcare center. The group 2 is the non-hazardous sanitary waste. Group 3 is the biohazardous sanitary waste, and we have a last group that's waste that has other hazards different than biological. We'll center in group 2 and group 3. That's the sanitary waste. The group 2 is non-hazardous, has the same treatment as domestic waste, so it goes to landfill. The only requirement that is made is that this waste is laid in thick bags. So this makes you assume that it's non-hazardous as long as it's not touched from the sanitary center or the healthcare center to the landfill. So as long as it's not manipulated, it's not hazardous. But if you touch it, there may be some hazards that can occur. The group 3 is the biohazardous one. It's laid in hard containers, and its destiny is sterilization by water steam at high temperature, and afterwards the trituration. So what's left afterwards, it's a non-hazardous waste that goes to landfill too. Okay. For many years, we've been focused on this group, in group 3, because it's the hazardous one, and we've worked a lot on it. But at the end, we have 1,700 tons a year of it. What can be done right now? We can manipulate it, we can do anything with it because it's biohazardous, so we can touch it until it goes to treatment. All we can do and keep doing it is avoid to mix the non-hazardous in it. So what's laid on these hard containers is just biohazardous waste, not any other thing that doesn't need that hard treatment, because the treatment, as you saw, is very intensive in energy consumption, sterilization, trituration, transport to landfill. So the less things we can put into these hard containers, the best. One thing else we have done is install a tracking system by QR codes in every container per container. We know where they are, where they come from, which healthcare center, not just which healthcare center. We can reach back to hospital units, hospital services, hospital floors, so we know where it comes from and where is this container at any minute. It gives us a lot of data. We know the quantities that's produced in any production unit, and that helps us increase the efficiency in the management of this waste, because we can see a unit that's producing more waste than another unit that's similar, and we can go and investigate what's happening, why they're producing more. So it helps us detect inefficiencies. But over that, we can't do more. We can't do more right now. And we've started to realize that it's 700 tons a year. It's a lot, but we have another group, that's group 2, the non-hazardous, from which we are producing 13,500 tons per year. So it's much more. Maybe we have to start focusing on that. It's not hazardous, but as I said before, when not being manipulated, but it goes to go and touch to landfill to ensure that's non-hazardous. We can touch it. We can do anything in it. The only thing we can do to lower this cipher, these 13,000 tons a year, is avoiding to buy single-use materials. But as you will know if you're in healthcare, reducing the single-use is hard work, because healthcare professionals are very used to single-use. It's very comfortable, it's very safe, and it's difficult to turn that. But we're working on it because it's the key to reduce these single-use materials and make substitution with multiple-use materials. What's in this group 2 of waste are always high-quality materials that are potentially recyclable. Most of this waste is protection gear, gloves, face masks, protection gowns, caps, shoes, one-use shoes or one-use socks. So it's a lot of material that is going to waste just with one use, and it could be used a lot of times more. and has good quality to be reused or recycled. And as I said, one other thing that we could do is a previous sorting, but this is very difficult to us too, because it requires deep changes in organization of the healthcare centers and requires a space for the different bins. And as you may know too, the space is not a thing that's that we have a lot in healthcare centers, so it's always difficult. So when we reached this point, we didn't know what else we could do, and what we said is a call for help. So to reach this help, what we did was send a preliminary market consultation. We explained all this trouble we were having. We explained what materials were on those waste, and we're expecting some solutions from the industry, the waste industry, or the whatever. We weren't much successful. The consultation was only responded by one proposal. It's a proposal of a company that was trying to make building materials with this waste. So just insulation materials or coating boards made of compacted healthcare waste. It was a very interesting proposal, but it was made by a recent Croatian company with not much structure yet, and not enough customers yet to give response to all those stones we are producing every year. And talking to them, there was an additional trouble, is they realized that they would have to sterilize all this waste before using it, which increased the cost of their material. As I said, it seems not very successful, but we're still talking with this company. We are collaborating. We're working together to find solution to collaborate in the future and to give them some of our waste. But we have 13,000 tons a year. So anyone else? And that's why we're here today. We're searching for ideas, proposals, experiences, whatever that you may have to explain and know what we can do with these very high quality materials that's in our waste, and we think they can be reused or recycled. And in the next few minutes, we're going to discuss that. Anita is going to coordinate this discussion, but for further on, I leave here my contact data, and please feel free to contact me whenever you want, so we can keep discussing or finding solutions. So thank you very much to you all for your attention.
Thank you very much, Jordi, for sharing your experience and journey up until now. So let's now open a discussion. First of all, I would ask all the participants, I see quite a few of you now, if you have any questions or comments for Jordi after his presentation. And you feel free also to write it down if you feel shy. Gael, I don't see any hand raised, so maybe I could break the ice.
There is one.
I spoke too soon. Hi, Massimiliano. Hi, go ahead.
Hi all, thank you for inviting me, and let me say hi to my friend Gael also. It's been a while since Alex.
Yes,
Hi Gael.
nice to see your name.
Great.
And to hear you.
Same here, Gael, same here. So just to share the experience in Tuscany so far with non-hazardous waste from healthcare facility. Basically, the management goes much like the management of municipal waste, as the speaker before me said. Of course, it is an issue to have, as you said, a proper available space inside an healthcare facility, to have the right number of bins in the right location, so the facility can be sure that the separate collection is effective. And Tuscany healthcare hospital were doing pretty well with separate collection of non-hazardous waste until the pandemic, of course, which broke everything down in this regard. And most healthcare facilities are slowly rebuilding up separate collection inside the facility. But in a nutshell, this is the most common system in Tuscany to recycle non-hazardous healthcare waste similar to municipal waste. So basically the same kind of waste we generate in our homes, such as cardboard, paper, packaging, bottles, and the likes. And then the public service for municipal waste management simply collect the waste from the healthcare facility. So there is not even a need for, there has never been, as far as I know, ever a need for a public procurement of such services for the management of municipal waste from healthcare facilities. And moreover, this, of course, as far as the quality of separate collection of waste from healthcare facility is high enough, such waste goes to recycling together with the other municipal waste, with no need for a previous sanitation of the waste. And that's pretty much it in Tuscany experience, which is very much like the rest of Italy, give or take. Of course, in some region you can have, sorry, you can have better result in terms of separate waste collection in healthcare facilities, worst result in other region. The same goes in Tuscany, of course, from one facility to the other, but pretty much the system is like this. Every healthcare facility has to pay the municipal tax for municipal waste management, and in return, of course, they get the service of municipal waste collection and recycling. And that's it.
Thank you, Massimiliano, for your input from...
Oh, I didn't introduce myself, sorry.
Yeah, indeed.
Massimiliano Di Mattia, just so it from my friend Francesco in the chat. So Massimiliano Di Mattia, Resource Recovery Regional Agency, an in-house company of Tuscany region, established in the early 90s to support on a daily basis public administration in Tuscany in delivering and monitoring public policies concerning waste management and these days, of course, a circular economy, and concerning municipal waste and waste from any other sources, of course. And that's it.
Thank you, Massimiliano, for your input. I don't know if Giardi, you want to have a comment, or if you would like welcome more questions or comments at this stage.
Well, all the recyclable domestic waste, we're trying to recycle it. So we separate it in origin, but it's this big group too that I talked about, that's our trouble. Once we separate these parts, it's still a lot of waste that needs a solution. We are using municipalities to, in the small healthcare centers, we throw this waste into the municipal recollection. So, and in some not much big hospitals too, we only have contractors in big hospitals. but for the rest, we use the public municipal service too.
Any other questions or comments? I don't know if it's an old hand, Massimiliano, but I still see that you're raising it.
Yes, I confirm. It's a second raising. The
Great.
second raising. So, okay. Now, I was just curious to know from Jordi the reason why the kind of waste you are concerned with, you are struggling with, is not collected by the municipality, since they are not hazardous, if I got it right. So why does the municipality not collect them for you?
The municipality doesn't collect it when it's big amounts. When it's a big hospital and the amounts are so big that they can manage it, they decline to collect it from us. So that's the and maybe in some cases we have a hospital that's quite far from the city, and it's up in the mountain. It's a bit isolated, and there is no route. There's no collecting route, so that's another motive. But mainly it's the amount, it's the volume.
So they are not even available to collect such high volume for a fee, for instance?
No, we've tried that.
Not
too.
at all.
No.
Okay.
In fact, they only their obligation, they have to collect only to citizens, to homes. They also recollect from activities, but it's they have a fee for that, but it's voluntary for them. If it's something that they can, it's difficult for them, they don't have to do it.
No, thank you, George. Now I got the problem. And well, in Italy, there is a legal obligation for public waste management service to collect also from non-household waste generator of municipal waste. Of course, there are for some waste stream, how can I say, limits to the quantity that the producer can bring to the municipality. But nonetheless, most of the municipal waste from non-household can be brought to the public service. So I run out of ideas to support you. I'm sorry.
Okay, thank you anyway, Massimiliano.
Thank you, Massimiliano. Any other questions for Jordi? See, we have something in the chat. So Anders is asking, and feel free later on to also speak if you wish, but I'll transmit his question. If you did a market analysis, actually if your market analysis covered the complete group 2 amount mixed, or did you try in a smaller scale covering only certain products?
We make the full mix because separating meat previously will suppose sorting before, and in the healthcare activity, professionals don't have a lot of time to think. So they separate. We're trying to make them separate the domestic parts because they are used to do it. They're used to it at home, but further than that, to separate protection items, it's very hard because we do need to put more bins, maybe more than one and more than two. And apart from that, the sterilization process is still necessary because although it's used one time and and sometimes very quickly. That they use is very short. They've been in contact with the healthcare procedures. So they've been in contact to patients, to blood and other fluids, corporal fluids that can have infections in them. So separate them before would help us make it more specific, but still is the infection trouble we have that increases costs, as I said before.
I don't know, Andres, if this answers your question.
Hi.
Hi.
Hi. I think my microphone wasn't on before, so that's why I wrote in the chat.
Okay, we can hear
no,
you.
my thought was actually if it could be a too overwhelming amount to offer the capacity of 13,500 tons.
Yeah, no.
And perhaps that could be a reason for companies not to answer on your market analysis.
Yeah. In fact, we were expecting ideas, not concrete services. So, and this company that came to us can manage a small part of that. They were talking about 4 tons a day. We're having right now about 12 tons a day. So they have this solution for our waste, but it's not very cost effective good, and we still have the rest of it. So yes, it's a maybe a trouble of amount, but we're not close to take just one hospital, for example. So it would be a good solution for us too.
Another thought is that it could be a problem also for someone to take care of all the different fractions, not only the amount, but also be able to refine it, since it's perhaps different products need different kind of material recycling.
Yeah, this
so
company.
I guess you might need a broker or someone in between in order to find plants, treatment plants, to cover all your need.
Mm-hmm. Yeah, that's right.
Thank you, Anders. And sorry, I haven't asked you to introduce yourself, but please feel free so that we know a bit also who you are and your organization.
Yeah, okay. I'm at the region of Skåne in southern Sweden.
Okay, great. Thank you. All right. Is there any other question or comment for Jordi? If not, we are also prepared another space where you can share your comments and questions. But please feel free to speak up or put a comment in the chat if you still wish to ask some follow-up questions on the presentation. Yes, Anders.
I tried to follow the link and I found the information in Spanish, but is there also in English? Is market analysis? No.
Sorry, not. It's
Google
not
Translate then.
It's not even in Spanish. It's Catalan, so not difficult to you yet.
But it helps to know when I use the Google Translate. So.
Yeah.
But we do have translated part of these documents through BRINC. So we will share with you in the chat a translated version in English. Yeah, as soon as maybe Gal can share, or I'll help her as we go through the Miro board. We'll share that so you have that information. You can take a look.
Okay.
Thanks for reminding us, actually. All right, if there are no further burning questions or comments, maybe we could open the Miro board for you all, for those who haven't yet spoken or wish to bring some ideas. You can just put a sticky note with some comments, insights on how to make management of sanitary waste more sustainable. We have tried to include the different categories Thanks for that. I think you should all see it by now. Just a brief introduction. We talked about the challenges before. Now we would like to focus a bit on the solutions, on the good practices, and I'm sure you all treasure and harbor plenty of experience and interesting potential solutions to this problem, to better managing sanitary waste. So we have included more of a procurement angle, so everything in the procurement process. And I think here probably can also pitch in this part, because we haven't had the chance of talking enough about also the process that led you to publish this consultation. So from the needs identification to the actual consultation, then more, let's say the first the bottom part of the pyramid, so how to reduce the consumption and extend the lifetime of sanitary materials. Then we would like also to talk a bit about the legislative measures and policies. And then lastly, once the material needs to go into the bin, how we could sort it and collect it and recycle in better ways. So please feel free to take a sticky note and to place it around these circles with your thoughts. And also maybe, as we were talking about different type of waste, we could also specify in the sticky notes whether we are referring to maybe group 2, so the non-hazardous waste, or to the hazardous waste, as we have done this sort of selection of this division. Seen this in the presentation from Jordi. So I'll let you, maybe I'll give you, if that's okay, 5 minutes to just write some thoughts, and then we can take the time to elaborate on a few of them. And also Jordi wants to ask any questions or to elaborate further. So maybe, yeah, let's take 5 minutes. And Maria is asking if we can zoom out slightly so we can see the entire board. And please raise your hand or your voice if you're not able to fill it in properly, if you have any technical difficulties. Yeah, so you should be able to zoom in and out. Indeed, I can also do it myself. Suzanne, I see you're encountering some problems. Can you just tell me what do you see? Or because it might be that it's maybe too zoomed out or too zoomed in, and that's why you don't see the board. But I can also share my screen to show you what I see.
Yeah, but Anita, I'm not sure that it's still possible then to edit the mirror if you're sharing your screen.
Apologies. Yeah, I just closed it. Go ahead. Okay, Suzanne says it's only black. How can we help her?
I will send a link to the mirror board in the chat for those who want to connect outside of the Teams window. Just give me a minute.
Good idea. Thanks, Gael. So let's take another couple minutes to add some inputs. And again, if anybody is experiencing problems, please speak up. We don't want to lose your input due to technical problems. Okay, I see that we still have some space left in the Mario board, so maybe let's take another couple minutes to keep filling it in. And if anyone prefers to speak up instead of writing, that's also, of course, very welcome to do so. Okay, thank you for your contributions. I see that you're still working on the Mario board, which is great. And also for information, we plan on leaving this board open at least until the end of the week. In case you still would like to put your inputs, as this can be a bit confusing during the meeting to also write. I understand that, but we wanted to still give you a space where you could structure a bit more your inputs. But mindful of time, we only have 5 minutes left, so maybe we could take the time to look at a couple of your inputs to start with, and then maybe also hear if that resonates with Jordi's experience, and Jordi, if you have maybe questions for the audience. So maybe regarding the legislative measures and policy instruments, I read here we have suggestion extended producer responsibility, and also to revisit the waste law to ensure that non-hazardous waste can really not be manipulated for use or recycle, which is quite interesting. And I think also Jardi, you also wanted to hear more from our participants on their legislative barriers. So maybe if you have a question regarding this aspect, maybe or any, let's say, final questions, one final question for our audience, and then we can keep working on the Miro board also after this meeting. But we're ending at 4:30, so maybe a couple last words also looking at the comments there.
On that comment from legislation, I think the same. For example, our legislation is from 25 years ago. Maybe we could revisit it. Is it really that hazardous? Is it really that contagious? It's really sure that we can touch it and reuse it and recycle it. We have an opportunity now in Catalonia because we know that the legislation is talking about changing it, and we're being invited to participate. So that's one of the things we will say. But I don't know, because who has the last say in that is the infection experts. So we're waiting on their opinion. But I think the same. The major part of the patients are not contagious, and the hazard or the danger is the same as household waste. So I agree with that.
Thanks. And maybe just one last sticky note. I see plenty of interesting ideas. Unfortunately, we won't have time to discuss them all. But it's here we talk about education, awareness, the promotion of sustainable alternatives. So I wanted to ask you, maybe Jardi, what do you feel is the perception by the employees also of the severity of this issue, and how open you think they could be to also a change prior, to the waste management, to re-see a bit how they throw the throwaway system in the hospital, and the awareness, and if there's any way of changing that, the behavioral, more of a behavioral change.
Yeah, I think we have an opportunity too on that, because there's a change. 10 years ago, it was not movable. That was the most important thing was safety for the patients, still is. But now healthcare professionals are thinking, okay, this is the most safe, but we have to think of other options. We can't stay in this way because it's no longer sustainable. So we have not much options, but their mind is more open than it was. So I think they will be open when there appear solutions.
Mm-hmm.
I don't know if of other health care managers that are here have the same perception. We've seen a change of mind in the healthcare professionals in the last 2-3 years. That it's hope. So.
Yeah, that's a huge part of it, of course. But yeah, like you say, it's also hard in terms of when you're rushing and the hospital rhythms, it's hard. So unfortunately, we're running out of time for this, just for the oral exchange. But as I said, we will be very happy to keep receiving some of your inputs when you have time. And we will make sure to compile them in a more agile document that we will share with all of you afterwards. And if any of you, well, the idea is to still create a mailing list on this topic and to keep you informed on our for future activities on this topic, and to create a community of practice to exchange ideas on this topic. Furthermore, we will have in September another meeting that we will focus more on the market side of this process. Today we have heard about the procurement side of it, and we will try in September to engage also the market side, to have maybe some pitches of available technologies throughout Europe that could help reuse and recycle this this type of waste. And again, feel free to also share ideas on enterprises, businesses that you heard offer some of these services. But we'll keep you posted on this with follow-up email, as I said, with compiling all these different and interesting contributions from today, and also informing you on upcoming activities. And I see the Miro board is moving, and it's painful to close the meeting now. But yeah, mindful of time, I think we should now close just this meeting, as I said, and not the Miro board. I wish to thank you all for coming, taking the time to bring your inputs on this super important topic, and also thank you, Jordi, for presenting your experience, and we hope that this will be also enriching for you to have heard a bit from others. And let's hope that we can move this procurement forward, also thanks to these type of meetings, the one we had today. So we'll be in touch. And thank you all for being here, for contributing, and feel free to contribute further on the board until end of this week. So thank you all for coming, and have a good end of your day.